Horses are domesticated mammals used for riding, sport, work, and therapy. They're intelligent and social animals, which makes understanding their health, especially parasites, very important. Horses are hindgut fermenters and graze close to the ground. This grazing behavior increases their exposure to parasite eggs, and their digestive system is quite sensitive. Horses are herd animals kept in stables, paddocks, or pastures. Shared spaces and high stocking density increase parasite contamination, especially for young horses. The common parasites to look out for in horses are Oxyurus equi, Habronema and Strongylus spp. First, Oxyurus equi is an equine pinworm known as rat tail of horses and donkeys. Oxyurus equi egg contains an unipolar mucoid plug. Have you ever noticed a horse with rat tail? It's a pain in the bum. How does the horse get infected with Oxyurus equi? One day, an infected horse passed parasite eggs in the feces. In the feces, the immature eggs develop from L1 to L3. L3 will then climb to the blades of the grass. The infected larvae L3 are ingested by the horse, which acts as a host. The L3 travel through the digestive system. Lastly, the L3 reaches the predilection site, which is the large intestine, cecum and colon. At the predilection site, L3 develop into L4 then to adult. The adult female and male mate. After mating, the adult female emigrate towards the anus to lay eggs. The sticky eggs clump to the horse's skin. This will cause itchiness in the horse. It will rub the perineal region against a tree or try to lick its anus to ease the itchiness. As a result, it will cause loss of hair coat, perineal irritation and anal pruritus. Habronema is a parasite causing summer sore on horses. Summer sores are caused by Habronema larvae deposited on wounds. This results in ulcerative, non-healing skin lesions. Adult worms live in the horse's stomach and lay eggs that pass out in manure. Flies pick up the larva while feeding on the manure. The flies then land on the horse's lips, eyes, or wounds and deposit the larva. Once larva is ingested, the adult worms develop in stomach, causing mild gastritis. Horses become poor in appetite and lose weight. Summer sores are formed when larvae are deposited on horse's lips, eyes, or wounds. Also, excessive tearing and scratching its leg or rubbing on a post. Strongylus spp. is a parasite that inhabit large intestine and can cause serious damage to the gut and blood vessels. Horses are affected when they graze and ingest the larva. The larvae migrate through the digestive tract, then penetrate the intestinal wall and travel into the arteries, and develop to adult worm in the large intestine. Horses infected with Strongylus spp show signs such as weight loss and poor performance, lying down due to colic, and diarrhea as worm damage the intestinal lining. How you can control parasitic infection in horses? From the environmental management aspect, you must remove manure from stalls, paddocks, and feeding areas at least every 24 to 72 hours. In Strongyles, eggs hatch into infective larvae in as little as 5 to 7 days under optimal conditions, so manure removal can break the parasite life cycle as eggs do not develop into infective larvae. Next, compost manure properly in piles or windrows before using it in. Make sure the inside of the compost gets hot enough, at least 104 degrees Fahrenheit, 40 degrees Celsius. This heat kills parasite eggs and larvae, especially Strongyles and Parascaris aquarum. Second is biosecurity practices. Clean and separate equipment. Do not use the same grooming brushes, tack, or feed buckets on new horses that you use on your established herd. This prevents mechanical transmission of parasite eggs between horses. Next is mandatory quarantine. Any new horse arriving at your facility must be isolated in a dedicated quarantine area for 21 to 30 days. Strategic deworming and anthelmintic rotation includes targeted drug selection. First, consult a veterinarian to select the appropriate drugs. So in Strongyles and Habronema cases, ivermectin or moxidectin are highly effective. Parascaris aquarum fenbendazole or parental salts and Oxyurus equi, benzimidazoles are a sensible first-line choice. Vector control includes fly management, where Habronema is transmitted by flies landing on wounds. Therefore, strict fly control is vector control. Use fly sheets, masks, and promptly remove and manage all manure, wet feed, which are fly breeding sites. For Oxyurus equi, the female worms lay sticky eggs around the anus. Daily washing of the perianal area with warm, soapy water is critical to remove eggs and stop environmental contamination from tail rubbing. Next is pasture management, which includes strategies to avoid overstocking and overgrazing. Maintaining grass above 3 inches discourages horses from grazing near manure-rich areas. Furthermore, harrowing or dragging pastures can help reduce parasite loads, but this method should only be used in hot, dry conditions and avoided during cool or wet weather. Alternate grazing is another effective strategy, where horses are cross-grazed with cattle, sheep, or goats to help break the parasite life cycle. Alongside alternate grazing, age-based pasture use is another important pasture management strategy. Grouping horses by age helps protect foals from heavy exposure to parasites such as ascarids. Lastly, provide supplemental hay when grass becomes overgrazed or too short. For stall management, feeding hay and grain in raised troughs or buckets helps prevent ingestion of parasite eggs. Regular stall cleaning further reduces the survival of parasite eggs and larvae. Next, for educating owners and managers, FEC identifies high parasite horses, guiding treatment, early detection, and record keeping. Then herd health management. Firstly, genetic selection and breeding. The horses with high resistance towards parasite was chosen to breed to produce offspring that are less susceptible toward parasite. Then for nutritional support, some critical nutrient like protein, energy, minerals like copper and zinc and vitamins were need to be supplied especially for pregnant and lactating horse. Then for monitoring and treatment, Fecal egg count and body condition score of the horse can be observed to indicate the worm burden. Good animal husbandry.
Herd separation based on age group can be practiced, which also known as alternate grazing. Each age group have different immune level. Biological control agents like dung beetles, earthworms, and fungal control like Duddingtonia flagrans can reduce parasitic growth. Besides, expose pasture to sunlight, acidic soil, and efficient drain system that prevent water trap and eliminate moisture can reduce the survival rate of the parasite. For summary, diagnosis must be done before whole herd approach. Then to ensure the efficacy of the parasitic control, all these control approaches are required.